Yeah, so this is a small study we put together, a retrospective cohort analysis of patients treated at the Mayo Clinic, Rochester, Arizona, as well as Florida, between 2002 as well as 2010. And we served to assess how many patients had acquired Waldenström syndrome combined with Waldenström Macroglobulinemia. This is a very rare occurrence between the two conditions, and acquired von Willebrand syndrome generally happens within a systemic process. There's been very few previous studies assessing the implication of both these different diseases and their clinical manifestations, which we hope to explore. What we found was that patients with these concomitant diagnoses had significant bleeding symptoms. We found a significant portion of patients had hospitalization due to events such as CNS hemorrhage, retinal bleeding, requiring them to undergo surgical embolization and other invasive maneuvers to get control of their bleeding symptoms. So just highlighting the importance of the dual diagnosis of these two conditions and the symptomatology that can be presented. I think one of the important takeaways from this small project was looking at also the impact of BTK inhibitor therapy, which is known to have increased bleeding risk, and the potential implications it may have on patients with von Willebrand syndrome. That's something we're actively looking to explore further as well.